Which one of the following is least associated with development of colorectal cancer in a patient with ulcerative colitis? So it is one of the easy question, short question, that is in case of the ulcerative colitis. In case of the ulcerative colitis, there is a chance of development of the colorectal cancer, but we have to find out which is the least association with development of the colorectal cancer in case of ulcerative colitis patient. That means a ulcerative colitis patient has a risk of development of the colorectal cancer, but which is least associated. Here the options are: unremitting disease, disease duration more than 10 years, onset before 15 years old, poor compliance to treatment, and disease confined to rectum. First of all, let's see the ulcerative colitis. The ulcerative colitis, it has different type of complications, and this complication includes colorectal cancer, fulminant ulcerative colitis, large intestinal perforation, several rectal bleeding or severe rectal bleeding, toxic megacolon, and fecal incontinence. So they are the risk factor for, or these are the complication of the ulcerative colitis. And the most important complication is development of the colorectal cancer, because the colorectal cancer, it is a disease, and in this condition surgical excision is mandatory. Then fulminant ulcerative colitis, then large intestinal perforation, several severe rectal bleeding, toxic megacolon, and fecal incontinence. Here we can see this is a figure, and here showing the colon cancer, such as here this is the sigmoid colon, and in the sigmoid colon here we can see the tumor, they are deposited in the different part of this colon or sigmoid colon, and they are spread through the other area via the lymphatics. So the ulcerative colitis, it increase risk of the colorectal cancer 10 to 20 times. So it is a huge risk of development of the colorectal cancer in case of the ulcerative colitis, and it increases risk 10 to 20 times relating to a normal individual. And the increased risk where there is chronic inflammation, that means when the disease present a longer duration of the time, when there is the chronic inflammation, in this condition there is more chance of development of the colorectal cancer, and it is worse prognosis than patient with ulcerative colitis. Patient without ulcerative colitis, so a patient who is suffering only colorectal cancer without ulcerative colitis, the prognosis of this patient is good. But when a patient is suffering from the ulcerative colitis with colorectal cancer, in this condition there is the bad prognosis. So bad prognosis where, when there is a ulcerative colitis and CRC, that means the colorectal cancer, and the lesion may be multifocal, that means this lesion may present multiple area of the colon, and there the increased risk of the colorectal cancer, they are the risk factor. Here we can see the risk factor. First of all, when disease duration is more than 10 years. So a patient suffering from the ulcerative colitis 10 years or more than 10 years, so in this condition there is increased risk of development of colorectal cancer. Second one is the pancolitis. Pan means whole. So what is pan? Pan equal to whole. So what is pancolitis? That means colitis of the whole colon. So when there is colitis of the whole colon, in this condition there is risk of chance of development of the colorectal cancer. First of all, here we can see this is a colon, this area, this is a colon, appendix. So when there is inflammation whole of the colon, in this condition there is a risk of chance of risk of increase the colorectal cancer. The second one, disease in onset 15 years of the age. That means a patient develop ulcerative colitis before the age of 15 years of old. In this condition there is more chance of development of colorectal cancer. Also the unremitting disease, that means the ulcerative colitis, it is continued, there is no remission phase. The patient taking oral drug, taking IV drug or other medication, but it is not responsive, that means the disease is not responsive to this conventional treatment. Then poor compliance of the treatment, this is also same like the unremitting disease, that means the drug is not working in this procedure. So these are the risk factor for developing of the ulcerative colitis. First of all, think 10-15. 10 means the disease duration more than 10 years. 15, that means the age onset before 15 years of the age. Then when there is a whole of the colon involvement, that means from the cecum to the rectum. When the disease is multifocal, that means it presents in the several area of the colon. And also when there is decreased compliance to drug or other treatment, and when there is unremitting disease. So which is least chance of development of CRC or colorectal cancer with ulcerative colitis? Here the answer is the disease confined to rectum. When there is disease confined only rectum, in this condition there is less chance of CRC relating to the pancolitis. Or when the disease involve pan, that means the whole of the colon. Here this is the pancolitis. Pan means the whole, or pancolitis, that means whole colon inflammation. Then unremitting disease, it is a true option regarding the colorectal cancer development. Disease duration more than 10 years, it is also risk of CRC development. And disease onset 15 years of the age, it is also a risk factor for development of the CRC. And poor compliance of the drug or treatment, it is also risk of development of the CRC. Only the disease confined in the rectum, it is the false, it is the true option, and it is false regarding the colorectal cancer development. So our answer is the disease confined to the rectum. It is not true regarding the colorectal cancer development in case of the ulcer.